Why is the COVID vaccine important? There are 4 reasons to get the COVID vaccine. First, COVID-19 is the leading cause of death in the US. Prior to early 2021, heart disease was generally the leading cause of death in the US. Reason 2, COVID vaccines are safe and are recommended by the Centers for Disease Control and Prevention, also known as the CDC. There were clinical trials with tens of thousands of volunteers from across the country, from all walks of life and all ages, to represent the US population. Scientific standards for safety were performed, and these COVID vaccines met US Food and Drug Administration's strict scientific standards for safety and effectiveness, which leads to the third reason, which is COVID-19 vaccines are effective as it helps vaccinated individuals from either getting sick or getting severely sick with the virus. Further, vaccinated individuals protect everyone around them. Therefore, the COVID-19 vaccine becomes highly important in stopping the pandemic. Experts continue to monitor and evaluate how the COVID-19 vaccine may affect the severity from illness from the coronavirus, as well as its ability to keep people from spreading the virus that causes COVID-19. Reason 4, COVID-19 vaccines are free, as the US government is providing them at no charge to any individual living in the US, regardless of their insurance or immigration status. So let's be clear. If you're living in the United States, you will not be denied the COVID-19 vaccine, as the vaccines are free of charge. Protect the most vulnerable. The most vulnerable are persons ages 65 and older. CDC has indicated that every 8 out of 10 deaths in the US are due to COVID-19 has been someone over the age of 65. Another vulnerable group are individuals with chronic health conditions. They include heart disease, as well as cancer, COPD, chronic kidney disease, organ transplant, obesity, smoking, sickle cell disease, Down syndrome, pregnancy, and type 2 diabetes. Also, individuals who are at risk for severe illnesses are individuals with high blood pressure, asthma, HIV, liver disease, and pulmonary fibrosis. Many Americans are either have one of these conditions, or definitely know someone with one of these noted risks. However, no, these lists seem to grow as COVID continues to spread. So please protect the most vulnerable. United States authorized COVID vaccines as the US Food and Drug Administration, generally known as the FDA, provides strict scientific standards for safety and effectiveness of vaccines distributed in the US. Up through now, the FDA has authorized 3 COVID-19 vaccines. They are Pfizer, Moderna, and Johnson & Johnson. Once an individual is vaccinated, all 3 vaccines protect the individual by producing immunities, which allows the body to fight the coronavirus. The Pfizer vaccine is given in 2 doses, and the doses are 21 days apart. The Moderna vaccine is also given in 2 doses. However, the doses are 28 days apart, while the Johnson & Johnson vaccine is given in 1 dose. Stop the spread of coronavirus, as it can have life-threatening complications. Unfortunately, there is no scientist, doctor, or anyone that can determine the seriousness or complications the effect the virus will have on you. Furthermore, once you are infected with the virus, you're going to spread it to your family, friends, colleagues, and others you may not even know. Once these individuals are infected, the cycle of seriousness and or complications continues. The important matter is to get vaccinated. Some vaccination locations are held in local community clinics, while others at popular locations to include pharmacies and grocery stores, offering plenty of parking. Yes, I got my COVID vaccine. Now you must maintain precautions. Once you get fully vaccinated, it is important to maintain all precautions. In Texas, it is no longer mandated to wear a face mask. However, health officials are emphasizing their use. Further, all federal buildings and public transportation requires the use of masks. As always, it's important to wash your hands and keep a safe distance. These are basic precautions. The possible side effects of the COVID vaccine. They are pain, redness, and swelling in the arm with the shot. Also, you be tired, you can have headaches, muscle pains, chills, fever, and nausea are also side effects, which should go away within a day or so. If not, please contact your physician. The COVID vaccine facts of being vaccinated versus not vaccinated. The vaccinated facts: COVID-19 vaccine cannot give you COVID. Also, COVID vaccine is needed even if you have already had the coronavirus. So being vaccinated has less risk of coronavirus, and there is a reduced length of coronavirus, and the symptoms are milder once vaccinated. If you are not vaccinated, know there is no live virus in the COVID-19 vaccine. It is possible to be reinfected with COVID-19, as scientists do not know how long the immunity lasts. Further, when not vaccinated, you are at higher risk of COVID-19. Now, generally, there is a longer length of COVID illness, and it is highly contagious, and the symptoms are generally worse to severe if not vaccinated. So choose facts, not fear. Nearly 40% of the US population is fully vaccinated as of May 2021. Therefore, you can follow the science and choose facts, not fear. Making an informed decision to be vaccinated, as local, state, and federal health officials provide consistent, positive evidence that the number of cases is dropping every day as the number of vaccinated Americans continues to grow, further indicating the evidence of receiving the COVID vaccine is important. As with anything, you may be faced with misleading information, whether through the media, friends, relatives, etc. But always remember, choose facts. The fact that COVID vaccine is the right choice and not to be feared. COVID vaccine saves lives. It protects you. It protects your family. It protects your community. So please stop COVID-19. Get vaccinated. We must conquer COVID-19. Protect yourself, protect your family, and protect your community. Get the COVID vaccine.